The surgical pause forms part of the World Health Organization surgical checklist, and that checklist really forms of 3 points. First check is undertaken when the patient arrives in theatre, the second point is when the patient is in the anaesthetic room, and the third is immediately before the operation takes place, and after the operation we do a checkout as well. The purpose of that is to undertake the checks multiple times, therefore you're not likely to miss any problems.
So the surgical pause is a brief moment of time out before any type of invasive procedure for the team to come together, to be clear that they have all introduced themselves, that they understand what procedure we're going to do, they've checked about the patient's identity and any allergies. We go through any routine elements of care to make sure that we've done that correctly, such as antibiotics or DVT prophylaxis. And then we make sure we've got all the right equipment for the procedure. It's a moment for the team to just pause before they start and to focus on what they're about to do.
So the advantage of the surgical pause from my point of view was that we were able to adapt it to the needs of individual specialities. As an example, my background is in transplant, and we've got a WHO surgical checklist that's specifically aimed to pick up specific points relating to transplantation that aren't necessarily on the general surgical checklist.
When we first started out with the surgical pause, we allow people to go through lots and lots of iterations to try to get the questions that were right for them. That was actually quite a few years ago, before the WHO checklist was widely used. And when that came out, we really condensed down to using that as the main set of questions. But some people have added on extra questions that are important for their context. So absolutely, now for us, the surgical pause is part of practice. We're still in that phase of getting there for the pre-list brief. Most of us would feel extraordinarily uncomfortable about trying to start an operation without a surgical pause now, and that tells you that it's become part of standard practice. But it hasn't been an easy journey. There have been people who've been quite cynical about it. And we have had instances where people have very obviously just been doing it in a very mechanistic way.
If you feel that you have to do this checklist and you don't really understand why it's important and you don't value it properly, then you can fill it in a very quick and unuseful way. So it's important that clinicians doing it kind of see the value of it and understand why the things are on it, that they are relevant to them and to their patient, and almost feel that kind of ownership of that list. And if they feel like that, then they're much more likely to fill it in a way that's going to be a benefit to the patient.
I see the WHO surgical checklist and the pre-list and post-list briefings important from a patient point of view, because the patient can then have the confidence to come into an operating theatre knowing they're going to come into an environment that is as safe as possible and have a team of people working and looking after them that are talking to each other and have put safety at the top of their priority list.